Hello, Assalamu alaikum, and welcome to another episode of Health is Wealth. It's lovely to be here, lovely to have a great subject to talk about, and lovely to have great guests with us as well, experts in their field who are here for you. They are here to answer your questions. They are here to give you insight about the things that maybe you think you knew about, but actually there's so much to learn when we talk about looking after your health. Now, the subject that we're going to talk about is dermatology. Dermatology is something that affects everyone, skin diseases, skin concerns. In today's day and age, I would think that people are much more conscious about how they look and how their skin looks as compared to, say, a few years ago. And let's have a look at this report, and it will give you some insight about what skin conditions are all about.
With a mix of muggy, dusty and increasingly polluted conditions, our environment is the perfect storm for infectious skin diseases. More than any other skin complaints, dermatologists in the country says infections drive people to their offices. The most common of these infections are caused by funguses like ringworm. The skin becomes more vulnerable after exposure to pesticides and other pollutants, which can cause allergic reactions and make it easier for airborne bacteria to seep into the pores. Pollutants do not just stay on the skin's surface, but penetrate into the deep layer, causing inflammation and wrinkling and disrupting the skin's function as a biological shield. Exposing the skin to air pollutants has been linked to conditions like premature skin aging, inflammation, and allergic conditions such as eczema, psoriasis, and acne. Number of patients with chemical allergies is also on rise. People working in construction, healthcare, agriculture, food service, auto repair, and cosmetology sector are more prone to skin diseases. These diseases can take several forms, including irritant contact dermatitis, allergic contact dermatitis, skin cancer, infection and injuries, and other skin diseases. Contact dermatitis, also known as eczema, is the most commonly reported occupational skin disease. Symptoms include painful and itchy skin, redness, and swelling. Use of substandard whitening creams are another cause of skin allergies. Many of these creams contain steroids and high concentration of toxic metals. That toxic metal, like mercury, penetrates into the skin, and over time, its higher accumulation in the body could damage heart and health of the fetus. In the case women applying such cream was pregnant. In this regard, there is a need to change societal mindsets of giving preference to fair complexion that often force young girls and even boys to use such substandard creams.
Okay, so you saw that report there, and to speak about today's skin conditions, we have experts in our studio. We're very happy to introduce Dr. Bushra Nadeem, consultant dermatologist, Rawalpindi Leprosy Hospital. Thank you, Dr. Bushra, for being with us here today.
Thank you for inviting.
And we have Dr. Noreen Sarfraz, who's also a dermatologist from Military Hospital in Rawalpindi. Dr. Noreen, thank you very much for being here today.
Thank you.
Okay, so there we have our guests, and we are going to try and bring, in the time that we have, as much information as we can, as possible, things that affect everyone. Okay, Dr. Bushra, let's start here with some of the major skin conditions that concern people in Pakistan. We'll go on to seasonal problems later, but what sort of patients do you usually see on a regular basis?
On regular basis in our OPG, we usually come across many varied patients like eczema, and this is a very number of eczema conditions like atopic dermatitis, allergic contact dermatitis, irritant contact dermatitis, very forms of eczema. Then comes scabies infections. Scabies is a very common infection in Pakistan. Then pediculosis, humans, lice, head lice, you call it commonly. Then there are other infections like impetigo, bacterial infections. Then there are inflammatory skin conditions like ichthyosis, psoriasis, and there are genetic conditions like xeroderma pigmentosum, Rothman syndrome. So there are many multiple conditions we see in our daily routine and in a lot number.
I see,
Yeah.
okay. So those are the sort of, the main things that you come across. Dr. Noreen, tell us a bit about, we have the problem of acne as well. How many people does that affect, and what is this, what are the sort of the myths around it?
Sure. Acne is now considered among the 10 most common worldwide diseases. Before it was considered to be the disease of teenagers, but now you can see that acne is prevalent in half of the people who go into their 20s and 30s, and a small group of people used to have acne even in their 40s. So what's acne? We should know this. Acne is a skin condition in which the hair follicle is clogged with the dead skin cells and oil from the skin.
Okay.
Now, the conditions which cause acne are genetic related as well. 80% of the cause is due to the genetic disorders. And the other factors which contribute to it are unhealthy lifestyle, in which you are eating most of the junk food, fizzy drinks, and eating a lot of carbohydrate food, and lack of sleep, not having enough water, and sleep deprivation as well.
I see. Okay, so that's very interesting because, like we said, there are many myths as well. We'll come back to the myths as well because we have viewers' questions. Dr. Bushra, we were talking about eczema and scabies as well. Are many of these diseases sort of prevalent because of lack of awareness, lack of education, lack of a person understanding how to manage the disease or prevent it?
Definitely, because especially in regard to scabies, it is a very contagious disease and it usually spreads because of the overcrowding and close contact with the patient and ignorance of the patient. So
what are the symptoms?
Usually there is an itchy rash in forms of papules. These are bumps on the skin. And patient feels nocturnal itching, that is itching at the night. That is very troublesome. And when you share the same beddings, clothings, even you're holding hands for a long time or you're hugging and any close proximity, then the mite transfers to the other person. You can spread the mite if the first person, which is contaminated with the mites, Sarcoptes scabiei, if he comes to the doctor at the right time, he gets treatment, then you can prevent the spread of the scabies. But if you ignore the symptoms and you lack the personal hygiene, that is taking bath, lack of washing the bed linens and everything, then it keeps on spreading and patient comes to us when it is spread to the whole household and they come with infective wounds even.
I see.
So, yeah.
And it's something that anybody can get. It's not specifically confined to.
No, anybody can catch it, but you can limit it with the awareness that it is a contagious disease, and if you know the symptoms earlier, you can diagnose it and go to the doctor at the right time. You can definitely prevent.
So if one person in the house gets this, will you have to treat the whole house, change all the beddings and treat everybody? Yeah,
definitely. If even single person is infected, you have to treat the whole household, even if the symptoms do not appear still at the other people, because the symptoms appear after 2 weeks of the contamination. That means the person already has scabies, but the symptoms has not yet appeared. So you have to treat the whole household. Plus, it can survive off the human host for 48 hours. That means it can survive in your clothes, in your bed linings and everything. So you have to wash these.
Wash everything.
Yeah, you have to wash these.
And a particular way to wash, or just usual?
In hot water, yeah.
Hot water.
Hot water.
That should do the trick. Okay. So that's a very important point that Dr. Bushra is putting across. That there are many conditions that we're sort of not really that aware about. And if you think that a member of the family has picked up scabies from somewhere, this is not a reflection on anyone. You just have to deal with it, and deal with it on a basis where you can sort of address the whole house, and everyone should get treatment and take care of the bed linens and clothes and hygiene as well. Okay, Dr. Noreen. Now, something. This is a question I've often thought about. When we talk about skincare in general, we're talking about chronic skin problems as well. But if we talk about skincare in general, the sort of climate that we're set with, the sort of messages we get as non-medical people, is that do we have to invest so much money in expensive creams and brands, or can we get the same result with something a bit more affordable?
Okay. First, we have to get the knowledge how should we take care of our skin. It will reduce and prevent the many skin diseases. First of all, we should clean our hands before applying any cream on the face.
Okay.
Then
and that's such a basic thing. And how many people remember to do that?
Don't forget, we have to apply the cream and we just rush, pick up the cream and just apply.
That's true.
We should have, sanitizers by our side or something so we can clean our hands. Apply the gentle cleanser on the face according to your skin type and scrubbers. Then what you have to do is when you apply the cream, you should have a basic knowledge what skin type you have and which cream you should use. Like for a very dry skin, the oil-based moisturizer products are used, and for a very cracked, dry skin, the petroleum-based moisturizers are used. And for oily skin, the water-based moisture products are preferred. And for aging skin, we should hydrate the skin very well, so it should look smooth, supple, younger. We should use the oil-based products with antioxidants and the alpha hydroxy acid that's against the wrinkles. And we should take a good care of our nutrition as well. And then you talked about applying the expensive whitening creams. People have so much craze to improve their complexion and have a different tone of their skin, which is in fact not there. So
An artificial.
An artificial one, yeah. There are many products available in the market. I will not name them, but they have a high concentration of steroids in them, which is not good for our skin for a long time. Like, they will not tell you that they are using steroids. Steroids are used by Hakims as well for a instant response. So the patients feel, oh my God, my skin is glowing.
My skin's glowing.
I'm looking more white and wow.
Yeah.
But it's not the condition. You should consult your dermatologist about the skin condition you are having in. And then we prescribe the topical creams or medications according to your skin type and the condition you are prevailing. Like, if we give some kind of steroids to you, then we give it according to the disease you are having and for a limited period of time and in a limited quantity. Because excessive use of steroids cause atrophy of the skin, thinning of the skin, and the telangiectasia, visible red lines and vessels on the skin you can see on many patients as well.
Right.
So consult your dermatologist. They will recommend you different creams and procedures, and never go for it blindly, like, oh, my friend is using that and she's having a very good effect, so I should try it as well.
That's one of the major concerns. So, take note of that. Don't just do what your friends are doing. Do go to a dermatologist if you have concerns and get it checked by them. We'll be right back after this break. Stay with us. Okay, welcome back. We hope you're getting a lot of information with this program. We're talking about skin conditions, skin care, and many of the ailments that we find in Pakistan. We have two great experts with us here today, and we're speaking to them about various things that a person is concerned about. Okay, Dr. Bushra, now let's talk about the effect of seasons on the skin. The winter season seems to sort of like create a lot of havoc on dry skin and things like that. What are the problems that you see in winter mainly, and how can a person prevent them and treat them?
Okay, definitely the weather is cold, dry and low humid. Humidity is very less. This is all very bad for the dry skins. For any persons having dry skin, xerosis, that is called xerosis cutis in medical term. And people having low blood to the peripheries, that is called chilblains.
Okay.
These two conditions we see very commonly in our OPD in dry weather. Cracked lips, cracked hands, cracked feet. These are other major concerns. So let's talk about how we can avoid them. When you see these patients, usually they have scales, flaky skin, red, irritated skin. So first of all, we tell the patients to take care of your skin properly. That's how you can avoid these dry skin conditions, because the natural production of the sebum, that is natural oil of the skin, that is stripped off due to the cold, dry weather. Even the low humidity takes out the moisture from the skin. So these two conditions make the dry skin very, very bad. So first of all, you have to keep your skin hydrated. And how you can do this? In the summers, you usually apply very light moisturizers, but in winters, you have to go for the heavy moisturizers. is you have to cut down on your scrubbing, exfoliation, especially for the dry skinned people. Second thing is you are prone to taking long hot showers or baths. You have to cut down on this because
very interesting.
because this usually strips off the natural oil in the skin, so it leaves your skin more dry.
So what about the steam that you're getting from a hot shower? Is that not good for you?
Steam is not that bad, but the water that is very, very hot, warm is better, but you have to go for the warm showers, warm baths, not hot.
Right.
Hot water strips the oil from the skin.
I would like to add one thing to your question about steaming. It just opens the pore of your skin.
That's better.
The steam you were
That's
talking
better
about.
for your skin.
Right.
Second thing is you don't have to rub your skin vigorously with the towel.
Okay.
That basically strips off the natural sebum. So you have to tap dry your skin.
Right,
That is very, very important.
Very, very important point for our viewers who are listening right now, because in the winter you do tend to overindulge in hot water, and because of course it's natural you do that, and a person does get a bit too enthusiastic with a towel.
Yes.
So that also is a very, very good point as well. So please, I hope you're taking notes.
We should treat our skin very gently, pamper ourselves, give ourselves a bit time.
And don't do that, do we? I mean, look, one thing I find is so strange is that, especially when you go shopping, you'll pick up great outfits and you'll pick up great handbags and shoes or makeup, but we won't go to the essence of where we're going to put this all on. And how much time do we take out to look after our skin? That's something that we're not doing.
That much.
Okay, so Dr. Noreen, tell us, the winter season, as Dr. Bushra has told us, all these tips and everything. In the winter season, should we adjust our diet according to the dry weather? Should we be drinking more water, which is sort of, it's harder to do because in the summer you'll want to drink more water, and in the winter you find out that you're not. So what dietary adjustments should we
Definitely, diet has a major role in maintaining the skin health, and we all have heard it so common, you are what you eat. So if you are having a healthy, good looking skin, it gives you more confidence and you feel good basically. So if you feel good, you will make others feel good as well. So we should drink a lot of water. We should hydrate our skin from inside to outside. We should drink 8 to 10 glasses of water at least, and then it again varies according to the requirement of the body, according to the climate, according to the activity you're performing. And secondly is that we should have the food which is written vitamin A, C, D, E.
Which foods are those?
Yeah, I will highlight that as well. Like you can have it in vitamin A rich in carrot, cod liver oil, citrus fruits rich in vitamin C, and walnuts, almonds, that's antioxidant.
Okay.
And the other things which contribute to it, the minerals which are rich in zinc.
Okay.
It helps to maintain your skin, hair, and nails.
Okay. So if you can't find these naturally, can supplements good enough?
Yeah, we can use it as well because these days we don't find much time for ourselves, as we have already discussed it. So we can have it, and there's no such harm if we are taking the multivitamins, and there are some very good multivitamins available in the market for just hair, skin, and nails, and they are affordable.
Okay, right.
Yes.
Okay, now we're going to go on to some viewers' questions. We have some questions been sent to us on social media. The first one I'll start with is Mr. Tahir. He's saying, when one looks for a sunblock, what should you be looking for, and what decides that this is the sunblock I need?
Okay. Basically, people usually, when they go for the sunblock, they only see UVB protection. This is not right.
Okay.
You must also go for the UVA protection.
Right.
So you go for the sunblock where it's written SPF 50, that defines the UVB protection. But UVA protection you can see from the A sign, A+++. That means it contains UVA protection as well, because UVA rays are also as harmful as UVB.
So A plus is something that a person should be looking for.
UVB, it contains UVA, UVB. Plus, you should select according to your skin type, because if you have an oily skin, go for non-clogging sunblock if you have a normal skin, you can go for any sunblock. But if you have acne-prone skin, you must go for a non-clogging sunblock. That has an oil control or sebum control for the special acne patients. And it is a myth that vitamin D is not absorbed through sunblock. No, vitamin D does get absorbed when you even apply a sunblock.
I see.
Yeah.
Right.
I would like
Dr.
to add
Noreen,
one more thing in it, just for our knowledge, that it's so important to protect our skin from the sunburn. It gives you protection against the anti-aging as well. Even you can see the
Cancers,
SPF
skin
available
cancers.
And we
in the
skip
makeup
that, don't
products
we?
as well. If you turn it and read the ingredients, it's written that it contains SPF this and this and this, and even in the eyeshadows, in the creams, and even the tinted creams are available. They
So
having
do
a
we
bit
need a
foundation
different
as well.
sunblock for our face and a different one
No.
for the body?
No,
Or can
not
I
at
use
all. Not at all.
Okay.
As the Dr. Bushra has already covered, that we should use broad band spectrum that covers both UVA and UVB, so we can have protection against both.
And what should be the number?
For
because they-
Asian
our
skin, it's
country.
SPF 50 to SPF 60.
50 to 60.
Yes.
Okay.
Plus onwards,
Right.
yeah.
Okay. Also, the same question from the same viewer is that you know, if you have to get laser treatment for dark spots on the face, is it very high? Is it very costly? Is it something
Okay.
easily affordable? What are the sort of the
Basically,
range?
this is an aesthetic procedure, and they are optional. If you want to have it, you can go for it. They are not that much costly. People are going for it these days. We have different kind of lasers available for it. First of all, we prefer the use of the topical medication,
Okay, you
and
start
then we
there.
see what are the results of it. And if it's not getting better, then we go for
Then
the
you
lasers.
go for the laser.
And it's according to the will of the patient.
Okay. We also have a question from Mr. Iqbal Bhatt. He's saying, what will make acne worse? Can you please sort out the myths from the facts?
There are a few myths and few facts. Basically, stress makes it worse.
Okay.
Yes. The diets which contain more of sugar contents, it makes it worse. Even hormones, even you're taking in a form of pills, or you're having menstrual cycle or pregnancy, it makes it worse, or for some people it makes it better. And when you're sweating less, like in winter especially, when the sebum or oil is detached from your skin, then our glands produce more sebum and we get more acne. So in winter seasons, we get more acne. Contrary to the belief, we get less acne.
Right.
And picking of the acne, it gets you infected and you get more acne. It's a cycle. If you pick your acne scars, you get more scars, you get marks, and you have more acne. Well, there are myths that you don't have to eat egg or fish or these things, anything which is rich.
This is the sort of the garam and the thanda
Yeah,
that's what I'm
concept,
saying. Yeah,
you know,
that is a
the
myth.
hot and the cold concept.
Yeah, that is a myth. That is
That's
a
a
myth.
myth.
No.
That's a myth.
Okay,
Yeah, that
right.
is a
So
myth.
we've got
Yeah,
it.
That is a myth. That was I referring
We've got
to.
it from the professionals. This is a myth. The hot and the cold, the garam and the tanda, you know, thing that everybody's always talking about. That is a myth. So keep on with your eating your eggs and your fish and things like that.
Dehydration makes it first.
I
Yeah,
see.
Dehydration.
So what about oily food? You know, sometimes you hear people saying don't eat oily fried food for acne.
They
Is
are
that true?
right. They are right.
Uh-huh.
Diet affects your acne as well. Like I have already told in the causes of the acne, that we should consume the diet which is low in carbohydrates. It helps you to maintain your good texture of the skin and fight against the aging. Like if we are so fond of the coffee, tea these days, especially in the winter, we can see a difference in our skin as well by sitting near to the heaters. We're not using humidifiers. These are the basic things we should take care of.
Right. Let's talk about the effect of the allergy season coming along, the pollen allergies. We visualize sort of just the sneezing and the runny eyes and runny nose and everything. How does that impact a person's skin?
Basically, there is a triad of asthma, eczema, and hay fever. Two are not related to skin. We are only concerned with eczema. But these three are related to the pollens. Whenever you have a pollen season, you get pollen allergy, you get increase in the skin disease that is called eczema, especially atopic dermatitis. So a patient who is atopic must take care of his skin. He should be wearing mask, avoiding the area where there is more pollen, and protecting himself properly. He should be covering his even nasoaerial areas, that is their mouth, in nose. So the pollens, the lesser you are in contact with the pollen, the more are the chances you get lesser of the flare-up of the atopic dermatitis.
Dr. Noreen, tell us about summer skins, because that is living in the part of the world that we do. That is something that becomes quite a problem. When we go into summer and it's very, very hot and you're using your sunscreens, but then you're sweating as well, and so off comes the sunscreen, off comes your moisturizer or makeup, or if you're not wearing makeup, whatever. How do we cater ourselves to have the most healthy skin during the summer as well? What should we do?
Okay, the basic formula for a healthy skin is basically hydration. Again, hydration from inside to out. Drink a lot of water.
It's so simple, and we make it so
there are
complicated.
Basic things, yeah, and we have make it more complicated by complaining we're having this and that. So basically, hydrate yourself, sleep well, good nutrition, and please do keep bit workout in your routine as well. It will help you out a lot. And then again, using the creams according to your skin type. Avoid too much makeup in the summer. Because obviously it will again
clog your
pores and it worsen the condition. Like acne becomes more worse in the summer season.
Okay.
Yeah.
Right. So we're talking about hydration, a bit of food adaptation as well. Cut down on the makeup. What about you talking about sleep patterns as well? What about cleansing as a routine as well? Not many people. The going to bed with makeup.
It's
myth.
a
Is
very
it true?
bad habit. It's a very bad habit. We should remove our makeup before going to bed. Use the deep cleanser or the makeup remover according to your skin type. There are various good brands affordable available in the market. So what you have to do, just wash your face with the proper cleanser, pamper your skin, give it a bit time, just do it in a circular motion, and make sure that all mascara, eyeliner, lipstick and foundation is properly removed before going to bed, and then apply a good night cream according to your skin type. It's very important. Even the makeup removing wipes are available these days. If you're so lazy that you go to the restroom, just have it and wipe it and destroy it.
Anything particular you have to look out for the wipes? Something that's not too drying for your skin? Or
No, it's very helpful if you just read it out. It's according to your skin type. It's a good makeup remover, and just you can use it. And one thing I would like to highlight is use a good quality makeup products, please.
Right.
And there are many fake products available in the market. Like we used to say, okay, they are not much costly, we should go for it. No. Don't compromise on the quality of the products which are affecting your skin.
Right. A person should be, very conscious of that. We're not telling you to go out and spend your whole salary on cosmetics, but there's something in between, so you can do that. Dr. Bushra, tell us the impacts of your mental health, stress. What does that do for your skin?
It plays a havoc on your skin. Basically, it aggravates all inflammatory skin conditions. Even in the normal person, it causes breakouts of the acne. It increases your dry skin by causing vasoconstriction in the body. It also inflates eczema, psoriasis, because it suppresses your immune system. So once the immune system is suppressed, you get many forms of infections, even chickenpox, herpes zoster. They're all infections, normal skin infections, viral infections. So it basically plays havoc with your skin. So first thing we tell to the patient, live a stress-free life. That is the basic ingredient to all the normal healthy skin, especially patients with the inflammatory conditions, which are genetics are required, whatever, but they must be stress-free. They must come terms to their disease. And nowadays we do counseling, a bit of counseling about this, because counseling is very important. Even in acne patients, we have to counsel a patient. This is a part of normal growing up. You have to grow out of it. You have to have a life which is stress-free. If you keep on stressing, it will aggravate. It will not make you good.
Then you'll be in the middle of a vicious cycle.
Yeah, it will make you more bad rather than making it good. It doesn't help. It doesn't help. It just makes it worse and worse. Even all skin conditions, you name it, and it makes it worse.
Right. Dr. Noreen, tell us, now we sort of see people are more aware of how they look, and they want to, which is a human requirement and very justified as well. Everybody wants to look good. So do you see more men entering the sort of the domain of being conscious about their skin care? Are they sort of a bit lost as to what they actually, should be using? If you could give them a few tips as well, because we're monopolizing the conversation about women and beauty care. So let's give the men who are watching some tips as well.
Well, the trend has been changed. Now, men are equally conscious about their skin care. They want to look good, beautiful, attractive, and they are equally into the products and even the makeup products. So we can see there are face washes which are specifically for the men.
We've got the whole skincare now for men
Yes,
as well.
we have a specific treatment for them, and even they come in our clinics as well for the laser treatment and for different kind of aesthetic procedures as well. So now the trend is changing. They're equally concerned and conscious about their looks. The basic treatment is the same, only they should be conscious about taking care of themselves, giving themselves much time, and using the sunblocks, because they are more prone to sunburn, because most of the time they are outside, they are performing outdoor activities, so they should use a good sunblock according to their skin type.
And what about moisturizing their skin? And
Definitely moisture. Even you can see in the moisturizer these days there is also a bit sunblock. If you have noticed, there is written that this moisture has this SPF. I will not name it this. So there are a lot of good products available in the market. You should consult your dermatologist and make it available and look more pretty and beautiful.
So you see, we're very gender balanced in this program. Okay, well, it's been lovely talking to you, Dr. Noreen and Dr. Bushra. Thank you so much for taking out time from your very, very busy routines and being here on the program.
Thank you so much.
Thank you so much.
Thank you so much.
Okay, so there were tips by our experts, insights into the problems you might be having, and this is something that it benefits everyone, it affects everyone. So do incorporate these amazing expert advice that we have got, and incorporate them into your daily routine. And we're sure you will, once you look better, you feel better, and everything connects very well. Okay, and welcome to our next segment, which is the emotional well-being segment, something that people are responding to very well, and they want to know more about different aspects of emotional well-being. We are going to talk today about social anxiety disorder, which is something that is quite common. Many people don't even realize that they have it. To talk about today's problem, we have Dr. Uzma Masroor, clinical psychologist. Thank you, Dr. Uzma, for joining us in the studios today. How common is social anxiety disorder nowadays?
I would say it is very common. It is very common because, this is basically inability and difficulty for a person to act, to respond, and to perform in social situations. So it is very common. You may have seen many people who do not perform up to the mark, or as per their personality, as per their knowledge and background in front of others. So it is just like a terror. It is not intense as panic attack is, but it is just kind of attack of terror.
Is it a phobia?
Yes, it is a phobia. And phobia, I would say specific type of phobia in which person is irrationally afraid of some situation, that is kind of social situation. So it is also phobia. Phobia is relatively more intense. It has more, I would say, consequences compared to social anxiety. While social anxiety, it is prevalent among normal people as well. They feel it difficult to deal with the general social situations. Not that intense, but in fact it is there. It is very prevalent. It is very common, and it has very adverse effects sometimes.
So, when we're talking about social anxiety disorder, does this necessarily mean a gathering where there are lots of people, or can it just be contained to just going somewhere where you have to interact socially with even just one person?
the situation in which there are a lot of people and the person he has this terror attack among many people, it is different type of phobia, in which going into the gatherings, having a lot of people around, maybe confined places, it is all related. But that is some other form of phobia. Social anxiety is something that is related to interaction, performance. It could be with one person, it could be into a group of people, and this person, when it gets comfortable with one or two people in certain situation, then he's better able to cope with that. But definitely in our normal life we have to deal with many people. While you are traveling in public transport, you have to see many different people daily, and at your workplace, at your if you are a student, then at your institution you may have to deal with a lot of people at the same time. So it is not possible to get that comfortable level. But at home they are comfortable. If somebody visits them, they are relatively better because they have some support from surroundings.
And they're comfortable.
They are comfortable in because they are in certain protected and known environment at home. And if somebody visits, they may not be that anxious because it is usually at strange places, unannounced.
How much is it sort of to do with fear of the unknown?
Fear of unknown is something else. That is generalized fear of unknown. You are constantly worried about something might happen, this might go wrong, that might go wrong, how would I do that, how would I do that? It is something else. That is fear of unknown is something else. It is very generalized fear. You are not even aware of what is happening to you, because very simple thing that you can easily say it may not be difficult for you, but still there is some part of your self, maybe it is in your brain or in your mind, that is constantly knocking at you, or never satisfied.
Is there a link between social anxiety disorder and low self-esteem?
Definitely, yes. There are links. General brought up the childhood experiences, the way they have been they have been, I would say, taught in certain situations, and relationships, maybe something has gone wrong with their relationships, maybe traumatized, they are traumatized in maybe in their home affairs, or maybe life experiences had certain repercussions for them. So they might develop not that healthy self-esteem, and it is very natural in childhood. In childhood, many cases, we have seen many cases, and usually it is very frequent not to have good self-esteem, because I think social setup also matters a lot, because parents are not much aware of this thing, how to raise your children, keeping their self-esteem preserved. So there are many reasons, there are many chances, very frequently. But later on, unfortunately, the person, he has encountered certain situations in which he could not perform up to the mark. Secondly, he might have people around him who are more critique in nature, who are more negative in nature, who are discouraging, and
that is
many
a very
factors.
important point,
Very
Dr.
important.
Osman, because it does make a huge difference as to the sort of reaction you're getting from people around you. If you say something and you're being laughed at, if you say something and you're being criticized, then that can damage a person's self-esteem. What we see usually in friends is that, friends can what they may perceive as being just harmless jokes or harmless banter may actually be damaging somebody. So if you sort of perceive that you have a friend or somebody who is feeling this way, or they're getting offended, criticism, constructive criticism is a good thing, but then we have to know where to draw the line to
because criticism is also important. You're right in this sense, and we definitely need negative attitudes from our environment as well, because then we come up with some challenge from inside. Sometimes negative situations make ourselves more strong to deal in future. But when it is persistent, again, excessive everything is bad. If something is persistently bothering, negative, it is not promoting any kind of, it is not encouraging at all. Definitely, it will again, cause more damage to self-esteem. And then, of course, social anxiety would be, I think, more intense.
Right. Okay, Dr. Ismail, thinking about the way lifestyles have changed over the years and the decades, we have now social media. which is a bit of a paradox, because it's called social media, but actually a person is really not physically interacting with anyone. Everything's happening in cyber world. Now, people who are suffering from social anxiety, are they using social media as a wall, very comfortable wall where they can hide behind then, because they're not physically having to interact with anyone, they have a completely different personality online, and then if you happen to meet them somewhere, they may be socially awkward, and you think that, you know, this is not the person that I was talking to or whatever. How much of a factor is that?
I agree with you. Definitely, it also contributes to that as well. But it may not be the exact cause. Yes, it can give some kind of protection to the person who doesn't want to go and interact. Definitely, it is a good place to hide. Yet they can have appreciations from everyone. They can have that self-fulfillment inside, as if they are throwing something on social media and everybody is like, wow, beautiful and all that. So it artificially heals his problem, but in fact it is pushing him more towards
seclusion.
Exactly. And they have this fear of, exactly, you're right, not coming up front and then interacting with people. But I think not extensively, I would say, catered environment is required. It is just normal environment that can bring them out of it.
Okay.
Simple encouragement from home, simple rescheduling of their activities could bring them outside of that.
Okay.
Parents should keep checking whether their child has constantly kept himself inside the room, or they are more into that thing. So it has also a lot of other negative effects also.
Of course.
And one of them is basically aggravating that anxiety.
Right.
Social anxiety. But if coming towards the causes, past experiences, personality itself, mode of interactions from environment, attachment styles from parents, and then relationships between the sibling, everything contributes towards that. And talking about social anxiety, more of that is related to their experience outside the world.
Okay.
Because for some reasons, if they could not get the required response they were supposed to, for some reasons, if they were unable to get that, it might cause that anxiety into them.
So, Dr. Asma, let's say there is a person or somebody that that is suffering from this disorder. It's very hard to sort of convince them, because to them, going outside or meeting new people or going into strange environments is terrifying. So how do you work with them? How do you get them to change?
Exactly. First thing is insight. We have to provide the insight to that person that there is something wrong and he needs to work on it. He should admit that, and he would be agreed to anything we are proposing him. So first thing is insight. Sometimes people don't have even insight. If they are chronic in social anxiety, they might get it justified. They might present with certain reasons they are not doing it. But in fact, first thing is to make them identify, to make them accept that thing, number one. And secondly, we cannot push them out of it in a comfortable manner, exposure, intense exposure at once. It's kind of flooding, that is dangerous. We can bring him out slowly and gradually with the bringing less intense situations first. We can slowly schedule their activities in a manner that they have to deal or interact with one person and then two person and then three persons. Initially, these situations are completely I would say structured, purposefully structured, and then slowly and gradually the generalization is done. Like they are taken into some more challenging situation where they are completely protected. And slowly every type of psychological problems is handled that way. This is the same sequence we follow. The first thing is to provide the insight, and then coming up with those strategies which are relatively easier for him to handle, easy to understand and easy to work with. And then slowly and gradually we can bring that person out of it. In this sense, two types of dimensions are taken into consideration. Number one is the thinking pattern, the mode of thinking, the cognitive side of a person, making him understand, asking him to explore some other options as well, and asking what ultimately could happen in this sense. So providing him some thought change strategies is important, and secondly some behavioral measures, because if you simply talk about and simply convince someone or going with his fear or his problem, and then you are not taking care of the behavioral side of it. Behavioral side mean bringing that person out of it by small tasks, some homework assignments, or some in-session tasks also. So this is how we bring him out.
Right.
So this is,
It'll be done
I would
gradually.
say this gradually. I think this disorder is, the disorder I've seen very frequently in my practice.
Right.
People, they have some other problems. In addition to that, they have this anxiety also.
I see.
So it is very common.
Right. Dr. Uzma, thank you so much for giving us all that insight into this disorder. And as Dr. Uzma told us, social anxiety disorder is actually something that she comes into contact with frequently. A person may not realize, but it's something that is there. So if you know somebody or yourself even, you feel that you're having these symptoms, or going outside, meeting other people, being in a certain social situation makes you anxious, there are things that you can do. She's explained them all, and it's good to be in control of what is happening to you, so that you can actually control things your way. And we'll be going on to our next segment, which is the medical breakthrough. Okay, and now on to our next segment. We try to keep you informed and up to date with what's going on around the world in terms of medical breakthroughs. Well, we'll talk about psoriasis right now and what's new in first-line treatments. Well, the latest research says that topical psoriasis treatments like sprays, foams and shampoos, as well as more advanced gels and ointments, are now available to treat larger or more sensitive areas. They're safer, they work better than old medications. Phototherapy is also available in a new form called narrowband ultraviolet B or UVB therapy. It's more focused than other light treatments and has a lower risk of skin cancer. Another approach, called the PUVA photochemotherapy, combines ultraviolet A or UVA light with a drug called psoralen, which makes your skin more sensitive to light. So there we've given you a bit of information, what's going on, something that can benefit many people. And we've come to the end of today's program. The program was on skin conditions, skin diseases, looking after your skin. We hope that you have learnt something and you have had such an informative program as we have had here, enjoyed this discussion. Do contact us on our Facebook page, Health is Wealth. We're looking forward to your questions. We took viewers' questions today as well. And stay tuned and do watch next week, as we will be there with a new topic. Until then, bye-bye.